Hi, everyone. I'm Risa, and this is Dr. Mitchel Goldman, and we're here to speak with you today about leveraging telehealth consultations for practice success.
I'm basically medical director of West Dermatology and the founder and medical director of Cosmetic Dermatology. We have 8 physicians in our local practice and 168 providers in West Dermatology. So telehealth is really an important for our organization.
And I come from the marketing background. I've been working in healthcare marketing for over 18 years. My company, Goldman Marketing Group, works with dermatology and other healthcare professionals around the United States and around the world. So I'm coming at this from the patient and marketing perspective. So let's talk about the telehealth pros and cons.
Well, this is your typical patient you're doing telehealth on. And even though it's a cartoon and basically it's holding a phone up to the patient's back to hear how their lungs are sounding, this actually isn't that far from the truth. You know, it's going to be pretty soon that we're going to be able to send patients some kind of a device, almost like the Apple Watches that you're wearing, to see their heart rate and their oxygen levels, and even we can measure EKGs over the phone. So telehealth can really be something that very efficient for patients and physicians to use. One of the pros of telehealth is that it's a very efficient way to have a medical meeting. It's efficient not only for the patient who doesn't have to drive to the doctor's office, but it's also very efficient for the physician, who basically can stay at his home or office and see a number of patients on the computer. Very efficient, very convenient, and then especially it's very safe because there's no personal interaction with patients, so we're not going to be transferring any kind of infectious diseases. But the problem with telehealth is it is impersonal. We are seeing our patients through a computer screen and or a telephone, and so we really can't see the nonverbal communication, which is very important when we're asking patients questions about their health. And then finally, we obviously cannot perform the procedures we are usually accustomed to performing on patients. Now, the New England Journal of Medicine had a really excellent article called The Ritual of the Table. And this just came out a few weeks ago. And basically what the article says is how as physicians, we really like to touch, see, look at our patients. And we really are losing that with the telehealth. So what we'd like to share with you in the next few minutes is how we can put back this ritual and how we can be better physicians in telehealth.
So is telehealth here to stay? How important is this? Well, with our changing environment, right now it's definitely extremely popular all around the world. But I do think people are getting more comfortable using technology, people of all ages and all over the world. And it's also becoming more financially viable for people to offer telemedicine. But in the end of the day, it doesn't really matter. Telemedicine is definitely here to stay, and that's why it's an important topic for us to discuss today.
There are a number of clinical considerations in telehealth. Usually, when I'm seeing my patients, a new patient visit is something that can be handled very easily virtually. It's a way that we can look at and hear our patients' concerns, and we can talk to our patients about their concerns and how we would address those concerns perhaps in a future visit. It's also a really efficient way of follow-up visits, especially if we're doing any kinds of surgical procedures, to make sure that the procedures are performed correctly and patients don't have any adverse effects. We can do that remotely through telehealth. And some patients actually prefer telehealth, again, for those convenience parameters that we spoke about before. And again, some doctors prefer telehealth, again, for convenience. But it's extremely important when we're performing telehealth to make sure that your staff as well as the patient is all on the same page. So the entire team needs to be doing this together. An interesting procedure that we can actually do now is a virtual biopsy. So if I'm seeing a patient and they have a mole which has a little bit of an unusual nature or color to it, instead of having to biopsy that mole, we now have mRNA tape stripping techniques that we can basically send this patient in the mail some of these tape strips and then talk the patient through performing their own tape biopsy. And this is an excellent way of distinguishing malignant from benign pigmented lesions. We're now also developing other ways of distinguishing between atopic dermatitis and psoriasis. And there may be additional virtual biopsy techniques that occur in the future. So the new technology is starting to allow us to diagnose without performing in-person procedures. Another thing that we can do is we can actually prep the skin prior to procedures. So if I have a visit with a patient on telehealth and the patient is concerned about melasma or post-inflammatory hyperpigmentation, we can actually send the patient skincare products to start the healing process, to start the process of treating their condition, and before we actually even see the patient or schedule the patient for treatment. In addition, we can, when we're looking at patients' wounds, we can evaluate them, and then we can send them healing products in the mail prior to their next visit.
So what are the financial considerations? Of course, this is a little bit different all around the world, but the biggest downfall is, of course, the inability to perform a biopsy or a procedure the same day as the visit. But to make sure that it still is financially viable, you should definitely review with your medical billing or revenue cycle management companies, if that is something in your country, how to best code. Coverage for medical malpractice insurance was something here in the US that was important to look at. And also comparing the revenues for a telehealth visit from an in-person visit, just to see how they can compare so you know how to price them accordingly. And there are some special considerations. You know, with telehealth visits, you really need to be on time. In the office, in a normal setting, you want to be on time, but I think there is some people expect doctors to run behind a little bit. But for a telehealth visit, if it's scheduled for 3 p.m. and this patient is waiting there, it's more important that you are prompt. We also are seeing possibly an increase in cancellations and no-show rates, perhaps because patients feel like it's not as important because they didn't get here in person. But basically, we want to look at the conversion rates from these telehealth visits. Are they converting to treatments and procedures? Are we retaining these patients? And most importantly, are we keeping our patients happy? So operationally, there's also a lot of important things to look at. It's very important to make sure there's a couple elements so that it runs smoothly. Scheduling, technology, and patient communication. You definitely do not want to have the first couple minutes of every telehealth visit saying things like, can you hear me? Can you see me? Okay, are we ready to go? You want to be able to get right to it. So how do you do that? Well, first, it's important to assess your needs, goals, and your resources at your office. There's 4 main buckets. There's the administration bucket, which is scheduling and templates and staff training. The financial bucket, like costs and billing and copays. The clinical considerations, like Dr. Goldman just spoke about. And of course, the most important, or one of them, is the technology considerations. What kind of software are you going to use? Is it going to integrate in with your main medical practice software? And establishing a support team to handle each area of these needs and resources is essential to make sure that you have a successful execution plan. So how do you choose the best software? Well, there's a lot of options. In the US, we look for things that are HIPAA compliant, which basically means that it's protecting your patient's safety information. But no matter where you are, it's important to make sure that the software has good bandwidth. So even at peak times, you're not going to have any blurry visions or delays in the software. And I think it's best if it can be integrated with your existing practice management software or electronic medical records. So with marketing considerations, first, what are you going to call these? Telemedicine, video consult, virtual consult, e-health, telemedicine. There's a lot of different terminology being used all around the world. You should pick what works best for your practice and then try and be consistent with it. Of course, you want to keep your patients in the loop on social media, on your website, via video, and make sure that everything's very clear and consistent across all platforms. You can see here on Dr. Goldman's website, we have a button here at the top that directs them right to this full page with comprehensive COVID-19 information, which is the current health crisis that we are experiencing. And then we also have created a video to help show patients what to expect and how to actually schedule.
Hi everyone, Melissa here at Cosmetic Laser Dermatology, hoping you and all of your loved ones are safe and healthy. We're thinking about you during this time. Our virtual consults have now gone live, and I'm going to show you how easy it is to schedule one on your phone. So first thing you're going to do is go to our website, clderm.com, and you are going to click on virtual consult. And from there, you're going to see a couple options: schedule a virtual consultation or email us to coordinate a visit. You click on schedule a virtual consultation, and then all of our amazing providers are going to show up with their bios, so you can read through all of the doctors' biographies and see who would be a good fit for yourself, and then choose the doctor, and then select a convenient day and time that's perfect for you. You will need to enter your email address as well as some other required information, but don't worry, it's all kept private and confidential. Once you click book appointment, you will then receive an email giving you all the information of your upcoming appointment. If you're using a smartphone or a tablet, you'll need to download the Next Patient app ahead of time before your virtual visit. When it's time for your appointment, you're going to go back to that email that you received, click on begin your video visit, and then you'll be taken directly to the app. You will be receiving a call from one of our medical assistants prior to your appointment to compile all the necessary information needed for your consultation, as well as to collect the consultation fee. The consultation fee can be applied towards your cosmetic procedure. Once your video consultation is completed, a medical assistant will be in touch with you to go over the recommended procedures, scheduling, and pricing. We look forward to seeing you in person and making you look and feel your best. Take care and stay safe.
So, along with that video, for Cosmetic Laser Dermatology, we've also done a lot of email marketing. You can see one example here of an announcement for virtual consultations with clear instructions and call to action buttons to schedule. And then, of course, as we said in the video, we want to make scheduling easy. Let your patients book on the phone, on email, via text message, or, and most importantly, online, which I really feel is the future.
So what should patients do before the visit? As Melissa was telling us in the video, we want to basically have patients send us photographs that are very high quality before the visits. And we will send the patients a poster. This was actually done through the American Society of Dermatologic Surgery that teaches the patient how to take a photograph. Some patients can actually take a photograph in the mirror, but what we would like our patients to do is try to get someone else to help take photographs and then send them to us so we can really see what they're talking about as easily as possible. In addition, if patients have other medical records from other physicians, we would like our patients to try to get those records themselves and send them to us. So before we actually have the telehealth visit, we have the patient's photographs as well as their medical record. During the visit, it's really important to be prepared. So we review all the patient records and photos before the visits, and then I always have a medical assistant with me who is transcribing the visit. And the reason I like to do this is so I can be looking and dedicating 100% of my time to the patient and not just sitting there typing something out on the computer. I think it's really important, especially being a little more impersonal, to give patients your undivided attention. It's also, as Risa said, incredibly important to run on schedule, because if patients are just sitting home on their computer, they want to be on time with the telehealth. It's also important not to have any distractions. So if you're doing this from your home, you don't want your baby on one arm and your dog or cat on another. You want to be able to have this in a nice private place. And then it's always incredibly important to set up the follow-up visits and the treatment plan before you're signing off. And this is something we have our medical assistants do. Very important to schedule your follow-up appointments before signing off with the patient.
So after the visit is a little bit more when the support staff and marketing comes in. Of course, as Dr. Goldman said, we want to ideally schedule the follow-up treatment or visit before they get off of the initial visit. But after the visit, you'll also be calling or communicating back to the patient with any diagnostic results. And I think it's always important to ask patients how their experience was. Did they find it personal enough? What else can we do to improve? Because we are always looking for this continual process improvement so we can provide better care for our patients. So ultimately, thank you so much for joining us today, leveraging telehealth consultations for plastic success. Here's a few of our personal photos so you can see us in our non-professional life.
Yeah, so my dog Otis, my incredible grandkids, and then the other photo there is myself with Risa and two of my best friends being prepared for jumping out of a perfectly good airplane. So whatever turns you on is what you should do.
And over here are both of our email addresses, our personal emails. We invite you to email us if there's any questions or anything that we can do to help you. We definitely want to help all of the doctors and dermatologists around the world be able to provide telehealth medicine in a way that is helpful for their patients and for their practice. So thank you so much.
Okay, be healthy and stay safe.